Did you know that 7 out of 10 Americans who have medical bills say that they have to lower their spending on food in order to avoid a medical bankruptcy? Navigating our highly complex world of healthcare and health benefits leaves many people feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to more than 150 employers around the country, and this is A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Join us as we discuss ways you can lower your healthcare and benefits costs, how companies are winning the healthcare and benefits battle, and how hope is being restored to this community and communities across the country. Hello again, everybody, and welcome to another episode of A Snowball's Chance in Healthcare. My name is Josh Butler. I am the host of this here program, and I'm also the president of Butler Benefits and Consulting, a local concierge type of healthcare brokerage and consulting firm located here in Amarillo, Texas. And each week we are sharing information. We're hosting guests. We're trying to give people hope in healthcare by addressing some of the bigger issues like high costs and access and high quality and things of that nature. And I'm really excited this week because I've got another good friend on the program with me, Bryce Heinbaugh. How's it going, my friend?
Hey, good afternoon, Josh. I'm hanging in there, man. It's fourth quarter. You know how that feels.
Hey, and I do know how it feels. And, we're having to squeeze in this episode, and I really appreciate that because I know you're extremely busy. So I really appreciate you taking some time. Ladies and gentlemen, Bryce Heinbaugh is the managing partner at IEN Risk Management Consultants, and he's also the president of Concierge Nurse Navigators. He's located up in the Cleveland, Akron, Ohio. What town do you live in specifically, Bryce?
I'm in the working class town of Ashtabula, Ohio.
Ashtabula, Ohio. What's the population of Ashtabula?
About 20,000.
Oh, well, that's
about
10.
it.
That's 10 times bigger than the town I grew up in. So
Okay. That's good then. It's good. It's a working class town, Port City, right on Lake Erie, about an hour east of Cleveland.
About an hour east of Cleveland. Well, thanks so much. And I know that you just got back from a recent trip. You were you at Montana or Wyoming? Where'd you go? You just went on my dream trip.
Yes, sir. I was in Wyoming, just outside of Jackson.
Oh my goodness, my ladies and gentlemen. Bryce just went on a big extravagant elk hunt for a few days or extended days. And I saw some pictures, man. Y'all killed some pretty good elk.
Yeah, man, I appreciate the compliment. It means more than those pictures. It's 12 years. What that meant is 12 years of out there failing, and finally got one. And it is we do DIY. So we don't hire an outfitter. Just hit the mountains and just stay persistent.
Well, congratulations. I mean, you're always in the pursuit of big game, and when you get back to your professional life, it ain't any different. Ladies and gentlemen, Bryce is also a Health Rosetta advisor. That's how we met each other. And he's one of the best in the industry. And I don't say that from just a technical perspective. I haven't met very, very few people. I can't even probably name another person that cares about his clients more than Bryce does. He's doing really, really amazing things. He's building very sophisticated and customized self-funded health plans for employers up in his region of the country. He's somebody that's a mentor to a lot of people in our industry. And like I said, not just in a technical sense, because he knows his work, he knows his craft very well, but your work's very inspiring because of how compassionate you are and how much you really do care about people and getting them access to high quality healthcare. So today we're going to talk a lot about that, ladies and gentlemen, and what's going to be very intriguing. You're going to see that Bryce doesn't talk a whole lot about health insurance, so that's the intriguing part of our industry these days. We do a whole lot more than sell health insurance, right, Bryce?
That's right. It's silly. Sometimes we get into meetings and people are talking insurance and all like this status quo garbage that, in the past, maybe that's what folks are used to. We just talk about health outcomes. We talk about people and we realize that if we can take care of people, everybody's going to pay less. Well, how do you take care of people? You don't run them through the mill. You get them to high quality, and you do those things. People are going to be healthier. They're going to be financially better. So physically, financial, emotionally, and you're going to have a stronger workforce.
Of course. And, we talk a lot about on this program how, finances and the cost of healthcare is arguably the largest barrier to quality healthcare in this country, especially when you go and you talk to blue collar workers and I live in a very rural part of the United States, and you do too. And, we're talking about a very blue collar industries in both of our regions. I don't live in a major city either. So I want to talk a little bit today about a program that you started not too long ago. It's off the ground and it's running and it's extremely successful, but it's called Concierge Nurse Navigators. And in the context of these self-funded plans, you are delivering a member experience to patients and, to clients and employer groups that I don't think is not very many people in the country are doing what you're doing. So let's talk a little bit and describe the concept. First of all, let's introduce the concept of what Concierge Nurse Navigators even is.
Sure. Great question. I'm used to explaining it. So, because a lot of folks are like, say what? Yeah. So really, we've been doing this patient advocacy, nurse care navigation for about 5 years now. And I'll say I had a personal life experience that brought us to this, but I also had a little bit of aha moment getting involved with Health Rosetta and reading Dave Chase's work. Also read a Harvard Business Review white paper in 2018 that said if self-funded employers were to adopt nurse care navigators, they would save $5 billion a year in unneeded and unnecessary services. $5 billion a year. And so that caught my attention, but I'm just going to take 2 minutes to explain the real life story that happened. So I told you we've been doing this about 5 years now. 2018 is when that Harvard Business Review white paper came out, and it was the icing that I needed just to move forward. And so, but 7 years ago, my wife's grandfather went into our local, remember, you just said, how big's the community? 20,000. Our local general type hospital, community hospital, that did a procedure on my wife's grandfather, a simple bowel obstruction surgery. These are common.
Sure.
But what we didn't know, we didn't know that the surgeon that day, unfortunately, has a very high infection rate, complication rate, and mortality rate. And so 7 years ago, Grandpa goes in, 8 o'clock the evening of that surgery, our family gets a phone call. Hey, Grandpa's not doing well. He's got an infection from the surgery, and it seems like it's gone up to his brain. And if anybody with some medical background knows, when you have an infection throughout the body, it's called sepsis. Unfortunately, later we found out the surgeon nicked his bowel before sewing him up that day and didn't realize it. And so we tried to medevac him. I told you we're an hour east of Cleveland. We tried to get him downtown Cleveland that evening, and due to fog in the sky, we had to wait 6 additional hours for an ambulance ride. That 6 hours, he arrived downtown Cleveland at 3 a.m. the next morning, and we immediately put him on life support. Life support for 4 months, at which point our family had to turn it off, and we said goodbye to Grandpa. Had we known what we know today about Dr. Death, as we call him in our hometown, we would have never let our family member go to that surgeon, never that community hospital, and Grandpa would still be alive today. I guarantee it. That surgeon still produces surgeries every single day in our hometown, and this type of information is protected about him. And so this is what we do. We guide, we shepherd. The key word is shepherd, and I say it many times, Josh. I do have a spiritual background, but it is a biblical term, shepherding. So we shepherd, guide, and protect people, patients, from that kind of thing as much as we can. And we know the more we do that for folks, the safer they'll be, the better outcomes they're going to have. And that's really the premise of what we do.
Yeah, it's amazing because, we talked about this multiple times on this show about healthcare is the only thing that we consume in the American economy before we know the price and before we know the quality. I mean, if consumers are given this type of quality information, because ladies and gentlemen, Bryce is using data and he's using information and he's using analytic tools to do the same thing we do at Butler Benefits, because we found out the key to lowering healthcare costs is improving access to high quality surgeons, high quality hospitals, high quality clinicians. But yeah, there's a savings component to it, but man, Bryce, when you tell stories like that, it's extremely personal and it's extremely powerful because I've never, ever once consulted a person or an employer group that said, you know what, I want to go to the worst surgeon in my community. I want to go to the worst doctor with the worst outcomes. Nobody ever wants to do that, right? So tell us a little bit, how are you ascertaining, and is it fair? I mean, how are you judging and gauging the quality of these surgeons and providers and facilities?
Yeah, another great question that we get a lot of times. We get it from employees, from their spouses. You know, how do you folks know that these doctors are any good? Well, the quick answer, and I say these words very clearly: evidence-based data, evidence-based data, and so we pay a lot of money for access to two different databases. One is the data out of CMS, the Centers for Medicare and Medicaid Services. Remember, 4,400 hospitals approximately in the country. They accept Medicare or Medicaid as payments, and if they accept reimbursement for Medicare and Medicaid, they are forced to report the quality of every one of their physicians back to Washington. That database is held pretty strong and tight. Mainly hospitals and insurance companies and the government are about the
And
only ones
Bryce
that have
Heinbaugh.
access to it. So we yeah, Bryce Heinbaugh, that's right. So we have that access to that data, and then we use another database that provides commercial data of about 3 of the largest insurance carriers in the country that also report on that sort of data. So evidence-based data helps our nurses surface who's good and who's bad, and ultimately all of our nurses, again, very important that our nurses are highly dynamic, critical thinking problem solvers. So that our nurses are typically past professionals in the business of transplant, ICU, emergency rooms. And so they're very used to helping guide and steer folks, and they're looking at things like readmission rates, infection rates, the complications, even misdiagnosis. Josh, we had the privilege. I took my whole nurse team to Washington, D.C. this year to be awarded this Health Plan Hero
Yeah,
Award. As you know, our colleague Katie Talento
yeah.
helped with that, and but we took some patients with us. 2 different patients, one with a cancer misdiagnosis who said that she was stage 4, needed immediate chemo. She had 2 kids. She was 44 years old. Had she put the chemo in her body, it would have poisoned her. She didn't have
Oh
cancer or
my goodness.
leukemia at all. We saved her life. Another patient of ours was told he needed a brain upper spine to brain surgery, and we had a second opinion. A center of excellence said, "No, man, you could die from that, and that's unneeded and unnecessary." These are the stories that we hear day after day, week after week, and quite honestly, all you need is one patient in one organization, one employee or their spouse, to have a situation like this, and it spreads like wildfire in the organization. And I'll tell you, the meaning and purpose. Like we're not talking health insurance, are we, Josh? No,
This isn't
no,
health insurance. No, it's sure not.
no, no,
But
no,
you're
no.
also, but
We're
your staff in this. Let me just clarify so everybody understands. I understand your program. We've talked a lot about it in the past. I've seen you do a lot of speeches and presentations. It's an amazing program, ladies and gentlemen. But concierge nurse navigators isn't a bunch of insurance people on the phone trying to be clinicians and doctors. You're not playing doctor. You're not playing pharmacist. Who is staffing this advocacy team at IEN, at your organization? It's not you. I mean, you're not the one that's saying, you're not giving it. So it's clinician driven, correct?
correct. Clinician driven. My business partner and co-founder, she comes from the solid organ transplant background, as well as quality of a major hospital, academic hospital, and so she oversees our nurse team. And these gals, I'll just say this great example. I was in Louisiana last week doing a logistics company, and had the nurse with us, and the nurse is standing right up in front of me, and we do educational and change management meetings for people to really win the minds and hearts of those folks. And I said, listen, your company, your employer has hired this gal. She's not with the insurance company. She's not here to try to go for you to go to cheap places. She's here. She's hired. Her only role is to help you and your families. find high quality, get you to validated doctors, and protect and shepherd you. That's her only role. You're her only customer. She's all committed, all in on you. And so when you share that with people, that she has no other misaligned incentive, no other initiative, that she's just there for you and your family, people all of a sudden really start to listen, and they start to really engage. And I'll tell you, Josh, in that one meeting I'm thinking about in Lafayette, Louisiana, yet last week, I had two different patients: a breast cancer gal and a gal who's in desperate need of a serious spine surgery. Both gals got emotional with us in the meeting. You could just see it on their faces. Just they're worn down. They're broken. They don't know what doctors to trust or where to go. They can't afford, prior to us taking over this account, they couldn't afford their health care. They couldn't afford all. The one gal with breast cancer is constantly having PET scans. They're a fortune, by the way, always having to hit her out of pocket max $7,000. And we looked at her and the gal with the spine and said, "Dear, y'all don't have to worry about paying a dime now. $0 deductibles, you're not going to have any out-of-pocket expense, because as long as you follow the guidance of the nurse to high quality, your employer is covering it all."
That's crazy. That's crazy talk, Bryce. That's impossible. There's no way that you can help these employers save that kind of money and waive deductibles and have $0 deductible plans. And tell the audience the truth. How are you doing it? How are you able to steer these people? Like, you talk about affordability, and we call them the functionally uninsured. They got health insurance, but they got a $5,000 deductible, and they're not going to get care because they can't afford the deductible. So let's bring that full circle. So how are you able to do that when it comes to a plan design and a plan arrangement to eliminate out-of-pockets?
Yeah, Josh, I really feel like you're one of the truck drivers last week that wanted to pin me against the wall and try to prove me wrong. And so one of the things that I've been bringing the last couple of months as we travel around the country, is I've got a patient case study, 2 knee replacements, one that followed the guidance of high quality, and the other that made their own healthcare decision and followed a billboard that said, "Our hospital is #1 in orthopedics in Ohio." Okay. The nurse guided plan to high quality. That person was back after total knee replacement, 4 weeks, total cost 1/5 the cost of the person that made their own healthcare decision, who got an infection in the knee, who actually got readmitted into the hospital for a high dose of injection IV, and almost lost their implant. The cost of that total knee replacement, because of the complications and readmission, was $108,000. When I show those 2 case studies, and I say, now you wonder how your employer can pay 100% of all your costs, because we're avoiding the infection rate, the readmission, the complication, all of this stuff. Yeah, we're saving the money because we're going to high quality and avoiding all that garbage.
So this is part of that $5 billion a year that you referenced a little bit earlier. Ladies and gentlemen, when you start to get proactive and you're managing risk, and the way we discovered some solutions, and like Bryce has, is that part of managing risk is ensuring that you get your people, and I'm talking to employers now, you get your people to the highest quality doctors and surgeons and clinicians and facilities in your geographical area that you possibly can. It's why Walmart, started this Mayo model, and that they had this whole list of diseases that if a Walmart employee is diagnosed, they don't mess around. No offense to Ashtabula, regional healthcare center where your granddad went and got his colon nicked. They immediately send these people to centers of excellence. And it's not because they're so benevolent. It's because the outcomes over long periods of time are so much better. And when the outcomes are better, it does what? It does what to the cost, Bryce?
It just lowers it, brother.
Drives it down. So you're doing this on a self-funded chassis. What if an employer comes to you and says, "Hey man, I'll pick on somebody. We're with Cigna, we're fully insured with Cigna and we want to do this." Are they able to do it, or is there have to be an educational and a transition process that gets them into like a self-funded chassis?
Yep, great question, Josh. To any employer out there that might be fully insured, the first step we say to them: listen, you got to be on that self-funded chassis for the mere fact that you need to eliminate as many of the misaligned incentives out of your health plan as possible. Get rid of Wall Street, get rid of the big bucas and things like that. In order to do what we do, again, waiving costs as well as every one of our clients, all of the employees and families get free diabetic supplies.
Mhm.
They get free durable medical equipment. We provide so much additional value in our plans that you can't do that under a BUCA plan.
Yeah.
It's just there's no way to bill for it. There's no way they're going to allow it to happen, especially any sort of steerage, perhaps to high quality.
Yeah.
You're going against the grain. So you got to get your data, and you got to look to trying to get self-funded. And I think many out there would be amazed to know that you can do it actually on smaller employers as well. Not that I'm in that space, not that you're in that space,
Yeah.
but some employers as low as 50 employees, you can do this stuff. And the sooner you realize that no one's out, for your best interest other than you, you got to make that
Yeah,
jump.
and speaking of, I want to ask you another question, because we can't leave something that's very important out, and that's the member experience. So I'm just curious, with what you're doing, and you said a minute ago, you said this kind of spreads like wildfire. I can only assume from a member experience perspective that these people that are your clients, they feel more like you're doing something for them than doing something to them. And I think there's a big distinction. A lot of time employees are so jaded these days. Anything you try to do in the benefit space, they're so jaded with the status quo garbage, is what you called it a minute ago, is that they think this employer, my employer, is just trying to save a ton of money. That's all they're trying to do. But what I hear, talk to us a little briefly here, because we got a few more minutes left, but I want to get to this. Tell us a little bit about the member experience. How are your clients, not the employers, but their employees, how are they responding to this type of advocacy service?
We have a book that's about two inches wide of feedback, written letters and thank you cards. It's Christmas time pretty soon, Thanksgiving time. We'll start getting cookies and baked goods sent to our office from employees and families who we've impacted their lives for the better. Okay. And I'll say to you that never before have I received this type of meaningful impact, like response or feedback from our clients, their employees and families, than we do right now. And again, for example, as what we just said, folks aren't going to like this. The member experience. We have the 8th poorest public school district in the state of Ohio as a client. So we're unionized groups, two different unions. When we brought this on, everybody was skeptical. What is this? This is, it's going to hurt us. We've delivered 3 years in a row. We've dropped their healthcare costs 3 years in a row, including failed tax levies, and we made up for it on the healthcare. Now we're pushing over $4.8 million saved to that school district. No one lost a job. Transportation remained. All the sports remained. 8th poorest school district in the state of Ohio, just because this model to high quality.
That's amazing. Congratulations. That needs to be shared in every corner of the country. And that's one of the reasons we bring you on this program, is so we can blast it far and wide. Last question I got, we got a couple more minutes here. So talk directly to our audience, these employers that are listening out there. They may be asking, how do I even get started? How do I even have a conversation like this with my broker? And, how can we bring these types of healthcare solutions to our organizations? What would you say to them?
Sure, great question. So any employer that's listening in, maybe they're catching your podcast or the radio station, the easiest thing I like to say to folks is hop on healthrosetta.org. Find an accredited Health Rosetta advisor around your neck of the woods. If there's not one close, just pick one out of your state. I think the last I checked, Josh, there were maybe about 250 of us around the country. Some of us, just you and I and others, have done a good deal of work. Some are just getting in, but the reality is we've all signed an attestation that says we're gonna be transparent. We're gonna provide the client a bill of rights, and every dollar is disclosed. No misaligned incentives, and that's in this business what matters most. Get somebody who's shares those same values, and like us, wants to do the right thing for the patient.
Absolutely. Well, we're going to wind down here, Bryce. I'm going to tell you, ladies and gentlemen, Bryce isn't a guy that just talks the talk. He's out there walking the walk, and he's making a huge impact on people's lives. I wish you more. I hope you quadruple in size just in the next year. And that's your biggest problem, is you don't know how to handle all the clientele that's coming to you. Because I do know, and I'm a big fan of yours. I've watched you for many years from afar, but once we kind of got it connected through Health Rosetta, it's been great. And I would echo that, get on healthrosetta.org. If you're up in the Cleveland, Ohio area, or in, anywhere out in that, look up Bryce Heinbaugh. You can connect with him on LinkedIn. I know you got a big presence there as well. But ladies and gentlemen, that's going to do it for another episode this week. Bryce, thank you so much, my friend. It's a pleasure to be with you. And as always, we're here to bring you tips and solutions and strategies, just like concierge nurse navigators. It's been a pleasure. See you guys next week, and we'll be talking about other ideas to give you a snowball's chance in healthcare. See you, Bryce.